Winston Peters, thank you so much for your time.
Good afternoon.
Are you still pursuing elimination of coronavirus?
Well, tragically, from the very beginning, internationally and in New Zealand, that language like elimination and eradication was never going to work because it wasn't, the dialogue may be a medical term, but it's not one when it comes to the transmission inside a society. So are we trying to get on top of it and beat the crap out of it? Yes, we are.
Okay.
For all those days, and all of a sudden, we've got to break out.
Okay, but what does beating the crap out of it look like? Does it mean zero community transmission again, or what is the goal now? Has your policy changed?
It looks like 102 days of great success only to find out that there's been a leak, a breach, and it's got into the community, and we've got to get out there and find it and all of its traces and all of its elements and all of its reach as fast as we possibly can.
Your country's top health official, Ashley Bloomfield, says the first case in this outbreak could have been in the community several weeks ago. Does this suggest elimination was really never truly achieved? That it was, sure, you were saying you'd eliminated, but clearly you hadn't?
Well, unfortunately, a lot of the conversation and a lot of the narrative is speculation. What we'd like to know is what we should know, and that is the exact details of what happened. And it is possible, with the modern science and all the tracing that we've got, to find out what this the first origins were. And I could almost tell you right now what I suspect it is because I've got inside information, but until it's confirmed, I'm not going to say.
Okay, well, if you've piqued my interest, obviously, because you're the Deputy Prime Minister, so I imagine inside information isn't just innuendo or rumour. Can you give me some indication about what those officials are telling you?
That wasn't an official. I found it from somewhere else, but I think there's been a breach inside our quarantine system. And I think when that comes very shortly, in a matter of maybe less than a day, we'll find that that was the case. But you don't always find out from your officials. You don't always find out from the experts. It's something to sort of find out by contact with other people. I'm not trying to be secretive here, and I'm not trying to avoid your question. I just think that these things are so difficult. And I just heard the New South Wales Premier talking, or the New South Wales expert talking. We went hard and we went early, but the question is, did we go hard enough and ensure that the policing, that the scrutiny and the quarantine was as tight as it could have been? And we need to know that.
Okay, this sounds like what may have happened in Melbourne as well. Are you saying the hotel quarantining is what you understand to be the problem?
No, I don't know where this quarantine breach may have happened, but I think you can eliminate it being some new strain of COVID-19 that hitherto my country hadn't seen. In Melbourne's case, of course, it was, how shall I say it, without being too critical, pretty slack oversight and supervision, where it was put in the hands of private industry, and that was a disaster. In our case, we got the army in early enough, or rather late enough, but early enough to know that that wouldn't have been the problem. We think, though, there's been a breach, and we'll find out in a matter of hours or within a day.
Okay, you say you haven't got it from officials, but you are, as I say, the Deputy Prime Minister of New Zealand. So who are you getting this information from?
I really wish I hadn't answered that question.
Well, I can't help but ask. Who's providing this information about quarantine breaches?
Well, a source that's usually very, very reliable. Dare I say it was one of your colleagues.
An Australian official?
No. A New Zealand colleague of yours.
A New Zealand colleague, a journalist?
A journalist, yes.
Okay, so there's a story that's about to break. You're telling me that there's been a quarantine problem.
No, it won't be breaking because we want to know, he wants to know, and I want to know, and so do all my colleagues want to know. Are we going to be speaking with factual evidence when we do go public?
If members of the infected family were visiting tourist sites and even going to work, does this outbreak then point to public complacency or even a failure in public health messaging as well?
No, they didn't know at the time that they were carriers. And so I think you cannot point the finger anywhere. The moment they did know, they went into lockdown. So whatever the situation was, they didn't know that there was a reason for them to go to a different lockdown than the one that the rest of the country was sharing with them.
So when you say quarantine breach information that you've received, have you now asked for officials to try to investigate where that happened or based on this information?
Well, basically, that should have been done by officials a long time ago, hours and hours ago. They should be on the case.
And has it been done? What do you know? What have your briefings told you?
Well, we've been told a lot of things. We've been told that there's a lot of testing going on, that the maximum number of findings from the tests are not yet known. There's still a whole lot of work to be done, but we should know sometime by tomorrow, I think 2:00.
Okay, and how key is this piece of information? You say police, you mentioned police. When you talk about breaches, where did the mistake happen?
Well, look, what you have is, in our case, we had 150,000 people either being moved out of our country or moved into our country, people coming home, so to speak. And so the first thing we had to do with this latest outbreak was to find what we were dealing with. And we know that we were dealing with a strain that has a UK and Australian parallel. So that suggests straight away it must be inside a quarantine situation or quarantine circumstance. And the next question is, well, then how did it get out? And that's what our full-scale investigation is focused on now.
And on the basis of that conversation you've had and this information that you've received, have you spoken to the Prime Minister Jacinda Ardern, and is she also of the view that this quarantine breach has happened?
I just got this information before I spoke to you.
So this is literally new information that you've just received that you're sharing on our program?
Yes, I am.
And what happens next? I'm just trying to sort of nail down, as you can understand, the process. Is this something that you will now speak to the Prime Minister about?
I'll speak to her senior officials and say, look, this is what the pointer is, but I would have expected that they are already onto it and that those people in the field are already onto it. Because at the moment the shape of the COVID species we were dealing with was known, then it would have pointed to where to look and where the leak may have been, and therefore trace back the person you're talking about. What's the connection between this homestead of 4 people where it started and the quarantine circumstance? There, I think you'll find, without prejudging the findings, that's where I think you're going to find the source of it was.
Okay. Your national response now requires all confirmed cases to be managed in a quarantine facility instead of isolating at home. Is that a feasible idea if cases continue to climb?
It's got to be a feasible idea. The problem with quarantine at home is that so much of it internationally has been proven to not be successful. Up to 30% plainly ignoring the restraint at home requirements or quarantine at home requirements and ignoring it. And when the phone calls were made or when the supervision happened, these people weren't home. So you're taking the whole system for a joke. You're asking all the people who obey the law to tolerate those who don't. And as I say, we've got to go real hard at this to get back on top of it again.
You've been an advocate for making masks mandatory. Will that happen in Auckland?
I hope so. I think it's essential. I think that the just plain common sense utility that stops the globules in the air, so to speak, by either coming to you or coming past that far from your mouth, is a serious defense mechanism. In places like Taiwan, they understand that, and most of Asia, they understand that. And we've got to realize that we're all in this together. So let's make it mandatory, and let's ensure that people cannot go into this utility or this service or this government department without their following all the rules.
Winston Peters, you say that you've received this information about a quarantine breach that you're going to talk to senior officials about, and of course in coming hours you hope to get more information. If there has been, and as you say, has to be established, a quarantine breach, what does that tell you about the way the system has worked? Who's responsible for that failure?
Well, that's what we need to find out. But remember, just like anything, any occupation, any sport, the better the game is going, the more time, the quicker you need to be worried. When things are at their best, that's the time to worry the most, because they can only go downhill from there. So we were going 102 days without one case. And yet it was clear not so long ago, this was happening inside our country. So it's been a salutary lesson to us to never let up, intensify our capacity, and again, once more, ask the team of 5 million to join this battle and this fight.
Intensify your efforts. Does that mean there have to be changes to protocols and practices around quarantining? Because you say you want to smash the virus, and look, respect for trying to smash a virus, which is a very, very awful enemy. How do you do that? Do you have to overhaul the way you do quarantining?
Look, Taiwan's got 24 million people. It's had less than 450 cases. It's had less than 20 deaths. This is pretty, a standout performance. I think Tasmania has done it more enormously well until recently somebody came back from Melbourne. So it can be done, but you can't take your eye off the prize, and the prize is victory.
Just in relation to this tip-off you've got about a breach in quarantining, you are the Deputy Prime Minister, it is a tip-off. Is it wise to be making public, I mean, I'm glad you've done it on our program, but to be making public a tip-off without yet having evidence that it did happen?
I think, as an experienced politician and as a lawyer, that it's axiomatic. The moment I found out that this strain is not unique to my country, it had to go to a point of entry, either by sea, either by air, or in quarantine facilities. And the quarantine facility is the one I think is the most likely.
Just on the impact of the big shutdown, and now you're shutting down again, are you worried about the economic damage this is doing to your country?
Well, it's huge. It's terrible, actually. And, it really is embittering for small businesses, all sorts of businesses, all sorts of families to have to contemplate this again. But there's no way out. And our job is to ensure that as many people get through this as unharmed as possible. And on the economic side, we'll be doing those calculations, in fact, overnight in the early hours of tomorrow morning, because we're going to have a package ready as a backstop to get these people through the next couple of weeks.
Tomorrow we can expect a decision on whether Auckland's level 3 lockdown will be extended. Do you expect the city is in for the long haul?
Well, if I was to answer that question, then it means I'm compromising any contribution I might make to that cabinet discussion at 3 o'clock tomorrow.
That'll be okay.
It's not okay to breach cabinet protocol in my country. This is not Australia where we have a spill and do what we like.
We're very close, though. We're friendly.
I'm just joking. But really, if you want to go to the cabinet with your integrity intact, don't spill what you shouldn't be doing, and particularly on an overseas broadcasting utility.
Okay.
But the real point is, on this matter I'm sharing with you tonight, it's so recent, but it was also something that I suspected when I heard that the B1 strain that we've got is one shared with Australia and the UK, which means somebody coming, probably New Zealand, out of your country, or New Zealand coming out of the UK, is the transmission agent of this in the first place.
But you don't have any evidence yet of that?
No, but we're hot on the case.
In relation to this trans-Tasman bubble we were hoping to have, I was hoping to visit your country. It doesn't look like it's about to happen, but I'd really want to if you want to work on it. I just am interested in when you think that might ever happen. And has what we've seen in Victoria, you were critical of what happened in Melbourne, compromised that?
Look, 2 days before we went into lockdown in my country, Foreign Affairs New Zealand was working on the bubble, the trans-Tasman bubble concept. And we worked so hard on it with all sorts of people, talked to premiers of states in Australia. We knew that it was a federal government decision, of course. But when we heard the news out of Melbourne, we all were in despair in our country, and I'm certain in Australia, because it meant now that not only weren't things happening interstate, they would not happen between interstate and New Zealand. I'm sorry, I've got no idea now where this takes us until we both of our countries, and I hope it's soon, get on top of it.
And have you shared your views with Australian authorities that you think the breaches that have happened in Melbourne were unacceptable?
Well, it wasn't for me to say that, but I tell you, when I watched it and saw the agencies that they had in control of it, I was really alarmed at what the outcome could be. And the same happened, of course, in my country, where we were in our cabinet arguing for the military to be brought in at day one. Well, they were brought in much later than day one, but thankfully soon enough, but perhaps not as comprehensive enough, and we'll have to find that out. In
terms of the economic damage we were talking about, do you have an idea for when you'd like this Trans-Tasman bubble to be up and running? Do you think it could be up and running by Christmas?
Well, if we get on top of our domestic circumstances in both countries, it is possible. But I don't want to hold out hope now, not when we came so near to thinking that we're going to get started with at least Queensland and Tasmania. And we thought we'd get started with some Pacific countries as well. And we weren't very far from doing that. Then all of a sudden our hopes were absolutely dashed. And it's miserable for our tourism ministries in both countries. It is really tragic. Our job is to ensure that we as an economy pick everybody up and make sure that people just don't massively fall through the cracks and have the despair that you'd usually prospect if a government didn't have the total all of government economic answer as the forefront in their considerations.
What do you say to critics in your own country but also internationally who say that this hard lockdown you went through initially demonstrates that you can't eliminate the virus, that it was a waste of time?
I say Taiwan. I say other countries which have done that and been very successful, not many. And I say to the ones who think that we can take it on with a Darwinian theory of survival of the fittest and not taking into consideration those who are going to die. I think we are holding out for the day when a vaccine turns up, and we put an enormous amount of money in alongside Australia to ensure it's available to our two populations and, dare I say, the Pacific as well, as fast as we possibly can. And so they'll all have their views, but when I see more people dying every day and catching this malignancy every day in the United States than my country in total, I think we still have taken the right option here.
Winston Peters, thank you so much for joining us on the program.
No, thank you very much.